Attention Deficit Hyperactive Disorder, or ADHD, is the most common psychiatric condition in children and adolescents in Singapore. But can the same be said for adults? If you figure that an individual with ADHD is someone who just can't seem to focus on tasks or is always fidgeting, then you're absolutely right. A person with ADHD might also find it difficult to organize their things, or is impulsive in their decision-making, their speech, and with their display of emotions. Diagnosing ADHD in adulthood is much more different and complex as compared to diagnosing it in a child. As ADHD is a neurodevelopmental disorder, its symptoms should have manifested before the age of 12 in order for it to be diagnosed. Many find it tough to recall their behaviors in their childhood, and they may have even been missed by caregivers or accepted due to societal and cultural norms. Furthermore, we adapt to our surroundings and learn to behave in socially acceptable ways, like compromising with others or waiting for the right moment to speak. It is not easy to determine if adaptive behaviors are due to healthy development or just something that's learned through the years. Since a person would have adapted to choose jobs and ways of life that ADHD would not hinder, they may not even realize that they have ADHD. ADHD does not vary just with age. Statistics have shown that females are more likely to be diagnosed with the inattentive aspect, while the hyperactivity aspect is more common in males. It is also harder to identify symptoms of ADHD in females. Treatment of ADHD can also be tricky. There are medications that can help to improve attention and behavior control, as well as therapies to target ways that an individual with ADHD can work on things such as time management, forgetfulness, and procrastination. Cognitive behavioral therapy and acceptance commitment therapy are useful in targeting emotional dysregulation, low self-esteem, and relationship difficulties, which are common among those with ADHD. If you find yourself struggling with symptoms of ADHD, here are some tips. To manage your distractions, find a quiet place or play soft music through your earphones. For organization, try making to-do lists, marking up your calendar, or setting up automatic payment or reminders for events. To ensure that you can always find your things, try allocating specific areas for specific items so you know where to look for them. To improve your focus, try breaking tasks into smaller chunks and taking timely breaks for a small snack before getting straight back into it. Thank you for watching. For more information on adult ADHD assessments, contact Psychology Blossom today.